Howdy, everybody. I just want to thank everybody for being here today. There's no doubt that these are uncertain times and that many folks who are listening in or watching this are facing a lot of unknowns. And that's exactly why we are holding this event today. As a Marine, I know firsthand the sacrifices our military and their families make on behalf of the defense of freedom for our nation. And the purpose of this webinar is to help our veterans understand what they need to do and how they need to do it. And we've brought in some really terrific experts to help us with that. So we're very fortunate to have the director of the VA North Texas Healthcare System, Dr. Stephen Holt, and Victor Roddy, who is their customer experience coordinator. Dr. Holt has been the director since late of 2017. He has 35 years of healthcare experience. He's a retired U.S. Air Force disabled veteran who gets his healthcare at the VA. We're lucky to have him here today, and he has been a great partner in advocating for you and on your behalf in Congress. Victor Roddy is also here. Victor has worked for the VA since June of 2012, and he served as a temporary director of the Plano CBOC in 2019. So thank you for coming to Plano and Collin County and helping us there. He's an Air Force veteran and was deployed in support of Desert Storm to Moron Air Force Base in Spain. And many people know him. And if you've ever seen him at one of my Coffee Brew Congressman events, right now he's in special detail dealing directly with the VA response to the COVID-19 crisis. So we're grateful to have you two here. We also have Tom Worley and Philip Wilson from the VA Regional Office joining us via telephone to help answer non-healthcare related VA questions. So we've got a great crew here to answer veteran-specific questions. And before we get started, I just wanted to just quickly let you know that you could click on the question and answer button right here on your screen. And you can type in your question, and then once you type it in, we'll read that off and we'll get you an answer. I want to let you also know that my office is available here to help you with things other than the VA. My team has been working around the clock on a variety of different issues. We've been helping people get with unemployment benefits, helping them with immigration issues, questions, Social Security questions, disability questions, economic impact questions, payroll protection plan questions, so all kinds of things, including putting together webinars like this webinar that we're watching right now. And so questions that you have, feel free to let us know. If they're outside the scope of this particular webinar, we still want to answer them. We still want to work for you. You can go to vantaylor.house.gov/coronavirus alerts and sign up for our alerts. You can even sign up, we have a specific tab just for veterans. So if you're a veteran and you want to get updates from my office directly to your inbox, you can sign up for that. And obviously, if for whatever reason they're not appropriate for you, you can unsign. That's no problem. Unsubscribing is not an issue. And also on my website, we have a page where we go over veterans issues, and that's updated frequently. But if you sign up for the emails, you don't have to go back and check the page. We'll push the information to you. Also, we're able to help you with non-COVID related casework, like navigating through the VA and providing assistance in the VA claims and appeals process. To date, my office, I've closed casework for 226 Collin County veterans, and we're actively working right now on many more. So we've actually solved 226 problems with the veterans have had in Collin County. And one other thing that we do that is a real deep honor for me is the opportunity to go get medals for members of the military. So if you lost your medals, we can get you replacement medals. If there was a award you didn't get that you should have gotten, we can help you with that. And last year alone, we got 168 missing medals for our veterans here in Collin County, Texas. And so if you submitted a question before the event, we got a lot of questions. We had a couple questions about economic impact payments to the federal government and unemployment benefits. Let me just point out that we absolutely want to help you with those. We'll get back to you. by other means and let you know how we can help you. On unemployment, that is actually run by the state of Texas. That is a Texas Workforce Commission run program, unemployment benefits. And they were absolutely overwhelmed at the very beginning of this. They're still working through a lot of problems. And my office jumped in to help. It's not a federal job, but it is something that our constituents needed. So we jumped in with both feet, and we've been helping a lot of people with their unemployment benefits and claims. And so I want to just say thank you for taking the time to be here. Thank you for your service to our country, remembering those who made the ultimate sacrifice just yesterday, Memorial Day. If you have questions, you can reach directly to my office, 972-202-4150. Or you go to vantaylor.house.gov/contact and send me an email. So lots of ways to get in touch. Here to serve, honored to serve you. And with that, I'm going to hand this over to Mr. Roddy and Dr. Holt. You guys can take it away.
Congressman, thank you very much. And as always, thanks for the outstanding support you've had for the VA in its mission to deliver care to America's heroes, its veterans. We are very fortunate to have very strong support. And so I really can never thank you enough for that. As a fellow disabled American veteran, I want to thank all of you for your service. I appreciate your interest in this call today, and I appreciate the Congressman's putting the call on today. I would like to say a few things before we get started. Uniquely, what we're finding out, it appears that veterans actually are faring better who get COVID-19 than the general populace. And we suspect that even though veterans on average have 3 to 5 more chronic medical conditions than age-matched people in the community who are not veterans, that the care that you're receiving is so much better, particularly in the preventive health areas. And we can actually prove that with data, that that's translating to better outcomes for our veterans. And when I say we can actually prove that, for instance, the Dallas VA is rated #1 5 out of the last 6 quarters for a thing called performance measures. These are clinical measures that are monitored electronically through the electronic health record. There are things like offering the flu shot, offering the pneumonia shot, controlling blood pressure, screening for depression, screening for substance abuse, offering smoking cessation, etc. And we actually had that independently validated last November when the AHA and the AMA recognized the Dallas VA as #1 in the entire state of Texas. All hospitals report data, whether it's public, private, or federal, in terms of controlling cholesterol and risk factors for heart disease and stroke. So we're fortunate that we have a great team here, and I take no credit for that. That's the team that was assembled before I came here 2.5 years ago, who've worked very hard to maintain the health of the veterans and provide these outstanding preventive health services that across the nation appears that they are helping our veterans not get as sick and not have the mortality rates that we're seeing in the non-veteran community. I'd like to also thank VBA team, Tom Morley and Phil Wilson, to be on here to answer benefits questions as they arise. And I also want to just take a minute to say, we're really at this stage, fortunately VA was doing this, had been working on telehealth for a couple of years. We found out we didn't have all the bandwidth we needed to go to the degree of telehealth that we're doing now, but the VA is rapidly building on that. But I really want to encourage you to consider telehealth options in your health care to keep you healthy, to be more convenient to you in getting your care. And one thing, teams should call you in advance of an appointment to see if you want to exercise a telehealth option. If you think you need to come in, we ask, or if you have an appointment to come in and you haven't been contacted, we ask you to call ahead to make sure we have the right care options for you. If you think you have COVID-19, we ask you to present to the ER where we can screen you, and if you appear that you might be positive, we are going to separate you to protect everyone from getting the disease, because as we're finding, this disease is incredibly infectious. And some of the best data we've had to date on this was what happened on the USS Roosevelt, where they tested and they found 60% of the sailors on board that ship tested positive for COVID-19 and had no symptoms. That's really scary. So even though in the Dallas area, we're seeing a decline in new cases, which is good, and we're really happy about that, this disease is still really scary. It is across the nation ravaging nursing homes. We're going to extreme efforts to keep it out of our nursing homes, which includes restricting visitors and who only people can go onto our units that work there, basically, and doing periodic screening of both the patients and the staff. So with that, the last thing I'll say is update, thanks to Congressman Taylor's advocacy, we are almost done with our expansion of the Plano Clinic, which will be another 1,200 feet. We're just waiting on the furniture to come in. And that new clinic will have a mental health suite as well. And the congressman is helping us locate, working on locating additional space to build a major project in Plano in that area as well. And I will stop there, sir.
All right, great. Thank you so much. So this is, my name's Anna McCormick, and I work for Congressman Taylor. So I'm going to go ahead and just read some of the questions that we have received both before the event and the questions that we're receiving right now. And so, you know, whoever is best equipped to handle those questions, feel free to hop on. And remember that for all the panelists, all of your phones are muted. So if you are going to speak, you do have to unmute your phone. So let's get started. And as a reminder for the audience, is in the bottom of your screen, if you're on a desktop, there is a question and answer button. It just has a Q&A with a little chat box. You can click there and send any questions you may have to me through that portal right there. So, okay. Our first question, the individual says, I was told that I had to call in to resolve a problem, but they can't get through because the phone lines seem to be busy. Will they lose their claim status?
That seems to be a VBA question, so I'm going to turf it to them.
Oh, I think you're muted. You'll have to unmute your phone.
Okay. How about now?
There we go. We can hear you.
Okay, sorry. Yes, that's something that we can help with. And what we'd like to do, in addition to talking a little bit about it during this call, we'd like to do some research on that person's case so that we can provide some additional assistance. So do you already have some contact information for that person?
I do. And after the call, I don't want to give it out over, you know, the webinar, but after the call, I'll go ahead and send anything that needs to go to you directly to you.
That sounds terrific. Yeah, we have public contact staff, and they're at about 15 out-based locations, as well as at the Waco Regional Office. And so that's really what our contact staff does, is to assist with questions like that. What we'll do is we'll have our coach, Philip Wilson, is the coach for our public contact staff, and Philip can call that person and get the identifying information so that they can research in depth there and assist him. The basic answer to that is no, that person would not lose their claim status. And we have a system of computer controls so that any claim that comes in the door, we have the information, we can research it and find out the current status and work to see that any difficulties get resolved. And we're glad to do that, anxious to help.
Wonderful. Thank you. And for everyone listening, I know Congressman Taylor said it earlier, but if you do have a specific question that is not addressed on today's call, reach out to our office. The phone number is 202-225-4201. Actually, let me double check that. I think I said that wrong. Let's go with this one, 972-202-4150. That will be on a slide at the end of the event, or you can just, Google Congressman Taylor's office. But give us a call so that we can get your specific information and make sure we get you the answers you need, or connect you with someone who can get you those answers. Our next question is, for medical care, I use Medicare along with a supplemental plan and a drug plan. Is it possible to use the VA for prescription drugs without having to see a VA doctor and have them prescribed the drug my regular doctor wants me to take?
That depends on two things. Is it a drug that's on our formulary, part one? Some prescribers in the community have registered with us so that they can send their prescriptions to us. So if your provider is registered with the VA, put a signature card on file, et cetera, you can bring your prescription. If you're eligible for care, you can bring your prescriptions to the VA to have them filled.
Thank you. Our next question is, how do you determine if you qualify for care remotely?
By remotely, do you mean you're too far away from the VA, or you want telehealth care?
So this was a question that was submitted in advance, and I don't have that information. Maybe just do a brief explanation on both.
Sure. So there is a tool on the VA website that allows you to put in your address, and it will calculate using, I believe, Google Maps. It calculates the driving distance to the nearest VA facility. If you are more than 30 minutes away for primary care, then you would be eligible to get care in the community if you opted to do that. The other option in there is, repeat the question, if you would, please.
How do you see if you qualify for care remotely?
Okay, so the other was the telehealth option, I was going to say. Telehealth, basically everyone qualifies for telehealth or VA Video Connect or telephone. VA Video Connect is a really nice product. You can do it on your smartphone, where you can actually see your provider and he can see you, or she can see you. Your provider can actually put what that person's seeing on the screen up, and you can see, like, if they're going over your lab results or showing you your x-rays, et cetera, you can actually see that. You can do it on an iPad, you do it on a computer, you can do it on a smartphone, and you can do it from the convenience of your home. You can do it from the convenience of work, not having to take some time off from work, et cetera. So unless we actually need to do a physical exam on you as a product of what the condition, I mean, say you're diabetic and you had a new foot ulcer, we'd have to examine that. But if it's just a routine care of, having your health monitored, your medications refilled, et cetera, we can do that. And we even look down your throat, believe it or not, with the camera on your phone and see if you got, might have strep throat. So the basic decision on that is, what is the condition that you're wanting to be seen for as a driver, whether or not we can do it through telehealth or we need to do it in person.
Thank you. The next question, Dr. Holt, and I do believe you touched upon this earlier, but I will go ahead and say this question is, the individual wants to know that if they're displaying symptoms of COVID-19, should they go to the emergency room or to the VA?
Well, it depends on how bad they're feeling. Because remember, if you're not having problems breathing, you're not having problems, you're being dizzy, you just have flu-like symptoms. Unfortunately, right now, there's not anything we can do for you. I mean, there's no treatment for this that's been borne out, proven. It would just, come in, be seen, we test you to see if you had COVID, and then send you home. If you have and there are multiple options. You can test it in our ER, you can get tested at one of the public sites that they run every day for COVID testing. They only do testing if you sound like you have symptoms that would make you positive. If you're going to go to the ER, a non-VA ER, one, you got to make sure that it's an in-network ER, because under the Mission Act, it has to be an in-network. And then second, you should contact your provider to make sure, unless you're really sick. I mean, you're really sick and you'd be driven to the ER or something, then just go to the ER. We'll sort these things out later. Remember also, under the Mission Act, you have three, depending on what category, if your categories 1 through 5, eligibility categories, you have 3 paid for urgent care visits per calendar year, okay, with no copays. But you have to go to an urgent care that's in network. And again, there's a website, missionact.va.gov, where you can go and find the urgent care that are in network. If you're not sure, you show up to an urgent care, they can look up and see if they are in network. They'll be able to look up and see you're eligible. They should not be taking payment information from you. They will not bill you for the copay if you have to pay a copay. And those are categories, eligibility categories 6 and 7. Or if you're in categories 1 through 5 and you've had your 3 paid for visits, you're now on number 4 or higher. But the VA bills you for the copay, not the urgent care. So if they're trying to get billing collection information from you, you're probably not in a urgent care that's in network. If they're not looking you up in the VA, you're not in an urgent care that's in our network.
Thank you. And while you mentioned the Mission Act, we do have a few questions coming in on that. It seems that some people are concerned that the VA Mission Act Community Care Program is actually going to be suspended. Is that true?
No. Right now, though, we can't make routine appointments in the community because the community is not doing routine care. So.
Thank you. We have several questions. I'm going to take some of the live questions coming in. Those were mostly some of the pre-submitted questions. Several of these questions are about the facility in Garland. So the first question from John, and he just wants to know when the Garland facility will be open for clinic visits.
We are anticipating being open by the end of July at the latest, hopefully the end of June. In a couple of weeks, we start moving excuse me, primary care teams over there. So we'll have 6.5 primary care teams. We'll be moving Mohs surgery in dermatology over there. We'll have a mental health presence. We'll have, I'm blocking on the other services, but
primary care, mental health, primary care, mental health integration as well. We're going to have MAS, social work service. We're going to have pharmacy support, not an actual pharmacy, but clinical pharmacists on the team, in addition to dermatology as well.
Radiology and lab drawing, they'll have a limited on-site lab, but they'll be able to draw labs there. And we should be opening up chiropractic over there fairly soon after to, because we have a large subscription to the chiropractic here.
Just to confirm, there will not be a 24/7 emergency room.
No, there will not. And there won't be 24/7 operations unless, you know, we've managed to stand up in record time. No one's ever done this fast, thanks to the staff here, the nursing staff, our construction folks, et cetera. We acquired that property on April 4th. And on April 20th, we were ready to receive COVID overflow patients. And we're still ready to receive up to 209 COVID overflow patients at that facility. That would be the only reason we would have 24-hour operations there.
Great. The next question is from Joseph, and he says that his cancer CT scans are overdue. When will radiology reopen? Radiology
is open. So he should not be having any problems getting those studies scheduled.
And how can he go ahead and schedule those appointments?
Call radiology, or if you can take his information and send it to me, encrypt it preferably, I will get someone to call him.
Okay, perfect. Joseph will go ahead and send that information along as well. Our next question is from Laurie, and she says, due to non-payment, my dentist in Plano has quit seeing veterans. How can a veteran receive a continuous treatment plan if the physicians are not being paid, if that's the case? I don't know if that's a widespread issue or a specific issue.
Most typically when that occurs, it's because their billing office is not submitting the statements correctly. Just like with Medicare, if you don't submit the paperwork correctly, they can't process the claim.
Lori, definitely reach out to Congressman Taylor's office and we'll see if we can help figure that out for you.
Yeah, if you can send me her information too, we'll look into it and see.
Great.
Okay.
Is it true that the phototherapy in Clinic 5 is being moved?
I don't know. I haven't heard that one.
We do have, as we relocate primary care teams from the Dallas campus to Garland and activate additional access at Garland, we're going to have a few domino moves here at the Dallas campus. So that might be in those domino moves, but any and all planning for that is still being finalized, and it's all based on where we have our greatest demand for access and some of our specialty clinics, such as eye, for example.
Yeah, so part of why we're moving the primary care teams out is to make room for these specialty clinics to expand. Some of them are landlocked, basically, like our eye clinic, and the only way we can expand eye services is basically bust down a wall and expand them into the adjacent primary care clinic space.
Our next question is from Richard, and he says that he understands Plano availability is currently very limited. Will the VA clinic in Plano be open to more Plano vets soon?
Yes, as we said, they completed the 1,200 square foot addition is completed. We're just waiting for the furniture to come in, and that will expand, I think, 2 primary care physicians. So that's another 2,400 patients we can take at Plano.
We also have plans for an additional 10,000 square foot clinic in the general area of the Plano Clinic. And that's going to help us, again, enhance our access for primary care and mental health as it continues to be a growing population. And all this is being done and worked on now as we prepare for the major lease project, which is going to be approximately 50 to 80,000 square feet of the clinic. Actually, I'm sorry, 90,000 square feet. However, that's still in the congressional approving process, and that's going to take a few years to award, design, and build.
By the way, let me introduce Mr. Garza, who's speaking here today. He is over all of our outpatient clinics that aren't on the main campus here. So Plano is one of the Plano Bottom, Fort Worth Outpatient Clinic, Tyler. These all fall under Mr. Garza, who unfortunately we're going to be leaving shortly because he just got promoted to a much higher position in another VA.
Well, congratulations. Our next question is, will there be female physicians at the Garland facility?
I can't say for, well, it will be, because women's health is one of the groups that's moving over there. That particular facility has a beautiful women's health clinic area. So yes, there will be at least one, or if not 2 female providers there. I'm not sure of the 7 ambulatory care providers, what the genders are.
Will audiology services be available at the Garland location?
Probably not for the next couple of years. I would have liked to move audiology over there completely, but the moving of the booths is very expensive, and it can damage the booths, and buying new booths is expensive too.
What is considered essential or non-essential when it comes to medical procedures now?
Essential or urgent care is care you need to have in a reasonably timely fashion so that your health doesn't deteriorate more. So non-essential is care that people get, but not getting that care for a period of time, say a month, 3 months, 6 months, doesn't significantly adversely affect their health, their long-term health.
If folks have questions about their care, they should contact the VA to get clarification on those items.
Yeah, with whoever is arranging that care for them. So if it's like a surgery, like a hernia repair, for instance, the surgeon who's going to do their operation can answer those questions. And don't forget, if you enrolled for My Healthy Vet Prime service or premium service, you can actually contact your providers, either your primary care doctor or many of the specialists, not all the specialists are on that net, and send them a secure message to which then they get and they can respond to. So you don't have to call and be on hold for a few minutes, for instance. You can send your question directly to your provider. And by the way, there's several great VA apps now available that enable you to do this from your smartphone.
So one of the questions we did receive is someone who wants to access telehealth services, but just isn't sure how to get started and needs maybe some additional help in that department. Are there any resources or contacts that individual can reach out to?
First off, their provider team should be able to tell them. And what they do, I actually did this really slick. I'm looking for Sorry about that. Somebody decided to call me as we're talking. There is they can send you a link for telehealth. There's a VETS app, VETS-APP, VETS app, which I'd urge you, because you could do the secure messaging and things from the VETS app. There's also the VA Connect, which is a software you can quickly download, and it enables you and your provider to go into a private chat room. So if you're going to get, say you call up your provider and say, I need such and such, and they make you an appointment. And then you say, can I do this virtually? And if the provider says, yeah, I can do this virtually, what they'll do is they'll actually send you a link about 10 minutes before your actual appointment to a secure chat room where you just click on your phone and it takes you right to that, and you can see your provider and your provider can see you and do your healthcare. You can also do healthcare by phone, obviously. I'm just regular speaking phone as opposed to video, but you can do the video on any device that's video enabled. So your iPhone, iPad, your computer.
Okay, the next question is from someone who's listening right now, and they said, I've never used my VA benefits because I used my benefits for my current employer. What do I need to do to be able to start using my VA benefits? I do have a VA benefits card on file.
Just register for care. If you have registered for care but not been seen for 2 years, you go inactive and you have to come back and register again. You should be able to do the registration. It's I think it's a 1010 easy form online actually, and submit it online, or you can come in and go to any of our clerk stations at our clinics, and they should be able to register you.
Can you tell us if USMD is approved to prescribe through the VA, or do they need to contact USMD directly?
They only can prescribe in the VA if the individual provider has registered with the VA.
Someone joined a little bit late, but they wanted to know if there will be an eye clinic at the Garland location.
There will be an eye clinic. It may not be in the initial phase 1, but there will be an eye clinic sometime within the next 3 years, as we phase in. Our phasing is a little bit limited by how much money we can put into the facility for the first 2 years.
The next question says, new facility openings are always a challenge. What would you like to see us do as patients to help the VA employees as they work out the kinks?
The biggest thing is let us know when something doesn't work right, or it doesn't work to their satisfaction, because that's how we fix things. Tell us what's not working, and we get on it and get it fixed.
There's also a email surveys that veterans will receive after a completed outpatient appointment, in addition to possible random paper surveys in the U.S. mail process. And so there's 2 avenues right there as well that they can quickly respond and provide feedback about their experiences at any one of our clinics, including the new Garland site once it activates and begins seeing patients.
Thank you. The next question is, where is this facility getting their PPE from? And do they, and do they have enough? Do you have enough PPE?
The answer to the latter question is yes, we do right now. Now, again, we've been fortunate that we weren't overrun like New York City was with COVID patients, or New Orleans, okay? But, this thing ain't over yet. We get ours through our standard prime vendors that the VA has contracts with, these large vendors that supply us with the PPE. We have had some PPE donated by private industry as well, which we're very appreciative of. But most of it comes through our private vendor contracts.
Okay. The next question is again about testing. Someone just wanted you to clarify, if they are a veteran and they want to get tested for COVID-19, where should they go? And then the second part of this question, though, is differentiating a little bit. If they want to receive the antibody test, where should they go?
Okay, so first off, Only people who have symptoms and history suggested of COVID-19 get tested. We don't do testing on just anybody. The antibody test is not that reliable. It's still being worked out, and we still do not have it available to use. But I want to underscore, it's not that reliable yet from the data we're seeing.
And very similar to what we continue to communicate to patients at every opportunity is, if you feel that you're experiencing symptoms, just call ahead to your clinic and let them know what those symptoms are, what you're experiencing, and they'll be able to better provide you with some clinical guidance. It may very well be that they want you to come in and be tested, or it may very well be that you should just stay home for 14 days or even visit the ED. So there's a couple of options with this kind of call ahead process.
Yeah, and one of the key things, if you are feeling ill, you have flu-like symptoms, you want to maintain your distance from other family members and other family members who might be at high risk for this. And again, I think the test, it depends on a variety of factors, but the test is only yielding 70 to 80% of the people are actually positive with the disease. So, your best bet if you think you have the disease is good hand washing, wear a mask, stay away from other family members, and, basically quarantine yourself for the 14 days.
Another live question we just received is, how do I transfer care from Bonham to Plano or Garland?
So the way that process would work is that if you are interested in transferring your care, contacting the medical administration service point of contact at your current site and letting them know that you're interested in transferring to a new site, they should be able to help facilitate that process based on the size of the physician panels at that location, and be able to assign as appropriate.
The next question is, do I have to pay my VA copay for prescriptions if I've lost my job because of the pandemic?
So if there has been a change in income as a result of employment, then there is what is known as a means test, in which there's that can be incorporated into that analysis and may drop you into a copay category in which you no longer have to pay copays. And that is just completed by either connecting via phone to one of our medical administration service points of contact, and or visiting us in person and meeting with any one of our check-in clerks that can help walk you through the process of updating your information. But having that loss of income information with you is going to be important.
So this is another key thing. So for veterans out there who aren't currently getting care, your friends who aren't currently getting care, if they drop below 115% of the poverty level, they become eligible in many cases for VA care. So if they've lost their job, for instance, your friends, neighbors who are veterans should be trying to establish VA eligibility for VA care.
The next question is regarding physician supervision. As a result of the pandemic, there were some regulations, I think, changed or altered to make sure that there was enough medical staff for treating COVID-19 patients. Can you speak to that at all, and just the quality of care patients would still receive regardless?
Well, we haven't been overrun, so the quality of care hasn't changed. There were provisions under the national state of emergency to use various healthcare providers in an expanded role to meet the COVID-19 requirements, but that's not been necessary to invoke that in the Texas region.
Thank you. What are the top concerns you're hearing from veterans about COVID-19?
Not hearing much. We're not seeing, I think we've had less than 60 veterans turn up positive since the start of this. We have a couple upstairs right now. I don't have the exact, well, I do have the exact numbers, I'll tell you. We have 7 positives in-house today and 1 under investigation. And we have, I think, a total, how many did you? 11 total currently here, but total veterans have been positive, 62. So, you know, we've been fortunate. I think in part, many veterans just aren't coming in because, again, it's like the flu. Other than symptomatic relief, like decongestants or something, we can't do anything to shorten the course of this right now for the large majority. If you get very, very sick, end up, for instance, a ventilator, we're looking at convalescent serum as one way to help you recover and not have a fatal outcome. But for the average veteran, there's not much other than symptomatic relief that we can do.
I think that testing continues to be a hot topic, if you will, with veteran patients. When can any veteran who wants to get tested? And I think that depends largely on the supply, the national supply of test kits across the country, and the demand continues to grow. So it's contingent on that as well.
The next question is, if I had a community appointment that was canceled as a result of the pandemic, should I contact the VA again or the community provider?
The community provider. If for some reason they say we can't do this appointment now because of whatever, other than they're not doing routine care, like we have to do another authorization, then contact us and we'll, you know, contact your primary care provider and we'll put the consult in for another authorization.
Excuse me. The next question states, I understand the VA can fill our prescriptions from our primary care doctor. How can we determine what the copay would be for those prescriptions?
I think it's $4 per prescription if you have to pay a copay, and that's basically like the mailing fee associated with that. So if you have 5 prescriptions, it'd be $20. Now, if you're 50% disabled or more, your script should be no copay for your prescriptions.
Are veterans from Collin County now allowed to visit the clinics in Collin County, the Plano facility or the new Garland facility, instead of going to Dallas Lancaster location for annual checkups?
Yes.
Is the VA doing any contact tracing?
We do contact tracing, a limited amount, but we do contact tracing to try and minimize the spread of COVID-19, particularly among family members.
We have another question about the Garland Hospital, and there are concerns of asbestos at the facility. Is there asbestos at the facility? And if there is, what is the VA doing to correct and remedy that?
Yes, there's asbestos in the facility. It's in the boiler room where only people who would work on the boilers would work. It is encased, so it's not a risk factor. And I say that because one of my specialties is occupational medicine. Encased asbestos is not a hazard. It's only when it's friable and exposed that it's a hazard. And we've had 2 engineering inspections there by outside engineering firms, and it's felt not to be a risk. And again, it's in the boiler room, which is down in the basement. That ultimately will be replaced because the boiler is one of the items that we need to replace. It's past its life expectancy, working fine, but past its life expectancy. So in the monies that we originally decided what we were going to do with the facility, replacing the boiler, replacing the chiller, and replacing the roof were the 3 big ticket items in bringing that facility up to VA and state standards.
If I need to go to the Dallas hospital, do I need to bring a mask or will you have one for me?
We'll have one for you. You'll be screened. Sorry, we're going to have a little interference that I can't control. We screen everybody coming in to the we ask them, have you had flu-like symptoms? We check the temperature, we issue them a mask, and with the exception of this video, you're required to wear a mask on the video, I'm sorry, on the campus. So,
Can you go over screening procedures at the VA facilities right now?
yeah. So when you come to one of the open entrances, they're going to ask you, have you had any flu-like symptoms? If you do, then they're going to take your temperature and they will route you to one of our second level screening places where they'll do a more intense look to see whether you could possibly have COVID-19 and hence keep you separated from everyone else to minimize contact and minimize people getting sick. If you pass screening, you don't have a fever, then they'll issue a mask and you go on to your appointments. But part of the screening too is we're keeping everyone out of the facility who doesn't have business at the Dallas VA. That's one of the key things in protecting our staff, because we are, up until COVID-19, is an open public facility. So anyone can come into the VA, whether they were a veteran or not, or have business or not here.
Thank you. So we're going to take our next and last question. And the question is, if I think I have COVID and I have to go to a local emergency room because I'm, struggling breathing, or it's gotten severe, will that be covered by the VA, or will I have to pay for that out of pocket?
If it is an ER that's covered in our network, it should be covered. But if you go to, otherwise you need to talk to your primary care provider and get authorization to go to a non-VA covered. But I'd emphasize too, that if you're sick, you'll get seen a lot quicker if you go to an in-network urgent care. And then they can evaluate you, they're going to be a lot faster about it, potentially, than sitting for several hours in the ER waiting area.
And by visiting missionact.va.gov, you'll have an opportunity to find those in-network ER facilities across North Texas closer to your home address.
And so, for the record, everyone should probably go ahead and look for those facilities before there's an emergency, so that if an emergency does happen, you're not having to look that up at that time.
And you should keep that website though, because if you're traveling, whenever traveling opens up, remember, this is it's a great benefit. I mean, you use an urgent care that's in network anywhere in the country. So if you're visiting your kids or you're visiting your friends and you get sick, just go to that website, find out what urgent cares are in the VA network in that area.
Great. Thank you so much. And I think Congressman Taylor is going to hop on right now just to wrap things up.
Okay.
Yeah, everybody, thanks for being on here. Dr. Holt, we really, really appreciate your presence. You've been a great leader in taking care of our veterans, most literally, in North Texas in general, and in Collin County specifically. It has been a deep honor to work for the veterans of Collin County for the last decade, and really appreciate your service and look forward to continuing to work with you to expand the healthcare facilities and access to healthcare that are available to our veterans in Collin County. For all those of you at home, thank you so much for taking the time to watch this. I hope we answered some of your questions. And if you have further additional questions, reach out to my office. We've put the information and link here, or you can go to our website, vantaylor.house.gov, or go call 972-202-4150 and call anytime. We'd love to help you. So with that, this will actually be posted on the internet in a couple days, and so you guys can and send it to other people. We have had some of our we've seen people from other states watch our webinars we've hosted. So it definitely feel free to share it around. It's a resource that's out there. We're here to answer questions and help people of the 3rd District and around the country. So thank you for your service. Appreciate you being here, and have a great day, and please stay safe.